the compounding is for if something isn't commercially available, we provide an option for certain patients, like whether it's cancer or a small child that has problems such as like they have Down syndrome or the inability to swallow tablets, or sometimes they just can't.
We can make it in a different form. So we can take that medication and make it into a lollipop or a troche, which can be the consistency of a gummy bear or like a Jolly Rancher hard candy.
We can compound a suspension that usually only comes as a tablet, and sometimes you'll have a tablet that, you know, it's the size of your thumb, where you can't expect a 5-year-old to swallow something that big. So it makes it better for the parents, it makes it better for the doctor, because at least this way they know that the child is getting what they need. And then when you have an older patient, say they do have cancer and they just have trouble swallowing something or keeping it down, the time that it takes a tablet to dissolve in their stomach, they could throw it up if they're nauseated all the time. So if you compound something like a cream that absorbs in their skin, then they get their medication and then they don't have to feel, you know, so nauseated, and they don't have to fight with all of that all the time, and they get the relief that they need after they've been suffering for so long.
Some patients are allergic to certain fillers that are in medications. So here we're able to, modify that and just break it down to just specific ingredients that go in compounds. We have a particular customer that we compound medication for who cannot have specific dye or lactose in there. So we make sure, we take care of them and put in there exactly what they need compounded.
My main purpose when I became a technician was to be able to do things like that, even in a hospital environment when you're compounding the IV solutions for patients in the pediatric unit or the NICU or people on the floor when they need their medication. I mean, that's the whole point. If you didn't like people, you wouldn't be in this job.
No matter what it is, we can compound it, as long as it's not something manufactured in that form, in that strength, we can make it.
We'll go above and beyond to help them in any way possible. And if it's not covered, we'll try to get them, approved through insurance, contact their doctor, or, if it's not meeting their needs, we'll do what we can to provide for them.
So for those that want to know more about compounding, you can come by one of our locations or call, and we'd be happy to answer any questions you have.